so to make blood smears, so you need all the equipment, right? You need gauze, right? You need what is called a pusher slide. So if you look at your lab, right, we are actually doing what is called a reverse smear. And it's designed to give you a very thin edge, what we call a feathered edge on the smear. So where you'll actually see a single layer of RBC. So if you look at the charts, right, see that, you see all the RBCs are in a single layer on the smear, and then you see the white cells are there, right, with the nucleus. So it's easy to identify. The red cell, if it's too thick, you're not going to see, everything's going to be on top of each other, so it makes it you're not going to be able to identify the white cells, okay, or even the red cells. So you need a pusher slide, and then you need a regular slide. So we use frosted slides, right? Why?
So you know where the top is and the edge?
And what else?
You label it.
You got to label the smears, right? All the patient's demographics goes on here. That is name, medical record number, date of birth, and things like that, and the date that you make the smear. So you do it in pencil. You can't do it in pen. Why?
The ink could run.
Right. You have to state it, right? So you're going to put this in alcohol and all of that. So, you know, ink, if you put it in alcohol, what happens? It's going to go, right? And you're not going to be able to know what slide you have. So the slides has to be labeled, and you do it in pencil, right? Now, you see that slide, you see the edges are square as opposed to that? Where the edges are like rounded. Do you see that? Yeah. At the top? So this is what we call a pusher slide. It's a rounded edge, and it's designed to actually do a smear on here like that. And so you get a nice smear, rather when, if you do it with a square edge, sometimes it goes off to the side. So the rounded edge is usually your pusher slide. So come closer so you can see, right? Blood has to be mixed well in order to make a smear. Why do we need to mix it?
So that it's even?
Right, so you get an even representation on this smear. Doesn't that make sense? If you take from the top, and, right, or too much from the bottom where it's, so this has to be mixed every time you're making a smear. Either you do it with the dowels. So we use what is called wooden dowels, like that. See that? And you actually need two. See if I hold that? And that actually goes in there. You'll find most labs, right? The machine can actually make a smear for you. Some of if you buy the expensive machines, they will actually do the smears also. But you have to like give it all the necessary ingredients, like the slides and all the stain and everything, and program it. So some of the expensive machines do make smears. But most hospitals do manual smears. And so the idea is to mix with this. And once, if they're not making a smear, you still have to check. You'll find most hospitals, they have that when it's, before they put the sample, and this will actually go with the cap and everything. It's a piercing cap, so the needle will actually go through the cap when the machine pierces it and take blood out. So the machine will actually mix it, then take the blood out. But what they do in hospitals is they check it. They use a wooden dowel, and they stick it there, do that. If there's a clot, it's going to stick onto the wood. And that's how they know they can't use the sample, and then that's no good. You have to ask them to give you another sample. But to make a smear, we need that wooden dowel because we have to have a very small drop of blood. Usually, you want to hold the sticks together and make one touch on the smear, and to actually make the smear, right? So everybody's going to get some blood to do it, and so you're using, right? And you want to make sure you're on the right side, so this is not frosted on both sides. You don't want a hole on top of this smear. If you do that, what do you think is going to happen? You get your thumbprints on there. What's on your thumbprints a lot?
Oil.
Oil. So when you make your smear, it's not gonna stay on there, it's gonna move, right? The blood is like water, it's gonna stay away from the oily part of the smear. And so your smear is not gonna come out correctly. So everybody's gonna get to practice a few of these, right? So yeah, I'm always holding the smear, the slides on the edges. And you have to practice that, right? So I'm going to do one for everybody. How many people we have in this class?
You do two for the people that
we
can't see.
in the back.
So what we're going to do, as I do it, you guys can rotate, come up front so you can see, right? So once you guys in the front see, you could just step back so they... And if you don't see, don't worry. Once you start doing it, I'm actually going to show you again. So you got to mix, right? Remember what I said? So you got to mix this, make sure you use the dowel, and you're actually making, you just want a little touch like that, okay? Then it's actually a reverse smear. So you go in front, draw it back, make sure it's even, right? And then one smooth push like that.
You're a pro.
Now, that looks very simple, right? Now this has to, your pusher slide always has to be clean, because if you get blood, it's going to create smudges on your smear. And so you're going to see, I'm going to spend a lot of time cleaning. See that? Make sure that there's no blood on here, right? And you're going to do this. Don't keep, first you're going to have to like practice like dry runs, right? But same thing, right? One touch. You do not want a lot of blood on there, right? You draw it back, make sure it's even, and one smooth push, okay? Now, if you adjust this, right, the angle, right, of the smear, see if I hold it like that, right? See, I'm holding it with one finger. I'm holding with, see that? With like 3 fingers, right? And one I put on top to balance it. So if I put it on here, see, if I increase the angle, I make the smear thicker. If I lower or decrease the angle with the pusher slide, I make the smear thinner. So you can adjust if you get too much blood on there, right? Usually if you end up putting too much blood, right, you can always take some out like that, okay? So you can remove some blood very quickly, right? And then you put your smear back again, right? Do that, and one smooth push. So some of you are going to have to try and doing, okay? You're going to try some dry runs. And dry runs mean is to just hold the slide, don't put any blood, and practice, right, doing that and pushing it. So you're going to get one smooth push. And you can't push it too slow. You see, if you do like that and you draw like and you do this, and I'm going to show you.
It's going to have lines in between.
No, you're going to see what